welcome to Compassionate Journeys, conversations about home care and hospice. So Pfizer has announced that its mRNA vaccine, which has received emergency use authorization from the FDA, protected 100% of 12 to 15-year-olds from symptomatic COVID-19. Moderna and Johnson & Johnson are in phase 3 trials for teens now, with an expected completion date of end of summer 2021. So why isn't every parent clamoring for the vaccine for their child? We are here today with Dr. Bernice Burkarth, Chief Medical Officer at Home Health Foundation, and a mom to find out. So thank you for joining me, Dr. Burkarth.
My pleasure.
So my role today is to play devil's advocate and hopefully ask all the questions which are on parents' minds as they contemplate whether to vaccinate their child against COVID-19. So first, Dr. Burkarth, will you please share the benefits of getting teens vaccinated?
Absolutely. So although we know that fewer children, and when I say children, I'm including the 12 to 16-year-olds. I am so sorry, kids. We know that fewer of them have been infected, right, with COVID-19 compared to adults. However, it's important to remember that children can still become infected with this virus that causes COVID-19. They can still get sick from COVID-19, and they can still spread COVID-19 to others. So, the CDC, the American Academy of Pediatrics, recommend that everyone 12 years and older should get a COVID-19 vaccination to help protect against COVID-19. And part of the reason isn't just a personal reason, right? It's not just for the child, teen themselves, or even for, their immediate family grouping, although that's compelling, right? It's also that we know, and I think we talked about this the last time, that widespread vaccination is going to be a critical tool, to help us essentially come out the other end of this pandemic. And quite honestly, we're seeing now some of the benefits, if you will, to being fully vaccinated.
Yes.
Right? And so including, not having to wear a mask when you're in the same household with people who are not vaccinated, for instance, right? So getting your child or your teen vaccinated is going to bring them one step closer to enjoying some of the activities that we've had to kind of put aside or limit, right, because of the extent of the pandemic. So
Absolutely. So I think a lot of people are wondering, is the risk-benefit ratio worth it?
Sure.
After all, so many adults are vaccinated now, and I think the thinking is serious disease is rare in kids, or is it?
Again, because people can still get sick from this illness, from this COVID-19, from the coronavirus,
Yes.
right, that causes the COVID-19. Ultimately, the risk-benefit ratio is a personal decision, right? I strongly recommend that if you have questions or doubts, that you speak to your child's pediatrician as well, to maybe get their individualized perspective, right? Because they know your child, because they've been caring for them all along. But also to get some broad-based perspective. And when I say it is a personal choice, it at this time, it is. These are not mandated vaccines at this time.
Yep.
Yet, to my mind, the benefit of really, as you said, right, 100% in terms of serious illness, hospitalization, that speaks very loudly.
Yeah.
And another, again, tool, another step in getting to a point where most of us, if not all of us, are vaccinated and can resume again the activities that we miss. So from a public health perspective, from a personal health and safety perspective, and then from an enjoyment of life perspective, certainly, to my mind, the benefits outweigh the risk. Again, a personal choice at this point for parents, right, and their children.
Sure. So mRNA technology for vaccines is new. Are there any additional risks outside of normal vaccines?
So the mRNA vaccine is new ish,
Ish,
right?
yes.
And while the implementation of this particular form of the vaccine is new, it's been studied for decades now. That we've come to understand more clearly. So, more additional risks, I would say no. And the reason is that this mRNA vaccine it does not enter the nucleus of the cell, does not alter the DNAs of your own cells. It has a segment with instructions on it that teaches your body to make fake spike protein similar to the coronaviruses, but not
Yep.
a virus.
Yes.
Right? And so your body gets this understanding that this is something that it needs to protect against. It's new. And the instructions decompose after. So, it doesn't stay in your body.
Yeah.
It doesn't go into the cell, the DNA
Yes.
of the nucleus of your cell. Doesn't alter your DNA. It's not live vaccine. It's not any form of vaccine.
That's an important distinction, I think.
Virus, not vaccine. Oh my gosh.
That's okay.
It's not a live virus.
Yeah.
It's really important to understand that piece of it as well.
Yeah.
To know that this is incredibly safe, and they're looking at it for so many other things as well. They're exploring, how this great technology can help to defeat other challenges that we have. So, it's new-ish.
Sure.
And it so far what we've seen has been that it's incredibly safe, this mRNA vaccine.
So for young people, what are the common post-vaccine symptoms? Certainly in adults, they've been widely documented.
Sure. And what we've seen for many of them are similar.
Okay.
Right. So you're going to have the pain, the redness, and swelling, the arm,
In the arm.
location,
Okay,
right,
got it.
of the injection. There can be fatigue, tiredness, headaches, and we'll talk about that in a moment a little bit more, but definitely milder headaches, some muscle pain, chills, sometimes fever that can be seen post-vaccine, and maybe some nausea as well. And those are the typical side effects that are seen
Okay.
in that category.
And for adults, those seem to last in varying time frames.
Yes, typically a few days.
Got it.
And typically within the first few days of the vaccine,
Okay.
right? And, just like with adults, certainly if there are signs or symptoms of COVID, which are that shortness of breath or that cough, that certainly a loss of sense of smell or taste,
Okay.
then you certainly want to reach back to your doctor. Not, again, that the vaccine gave you COVID, because they can't, because they don't have it.
Yes.
Right?
Right.
But you might have been infected pre-vaccine.
Absolutely.
And are showing the symptoms now. So any symptoms that mirror COVID infection, certainly you want to reach out to your medical professional, pediatrician, physician, primary care physician.
Okay. And you mentioned headaches. Is there something special about headaches?
Not for this vaccine.
Okay.
Right.
it.
But,
Oh, yeah.
when we talk, and certainly right now, the J&J, the Johnson vaccine, is not available
Yes.
to younger people.
Mm-hmm.
But there has been talk in recognition of clotting events tied to the J&J. Still very rare, right?
Yes.
It's 7 in a million, so
Yeah.
it's still exceedingly rare, and primarily occurs in women younger than 50.
Okay.
But this is for the adults.
Yes.
And it's one of the things to look for within the first 2 to 3 weeks after the vaccine, or a severe headache, shortness of breath, swelling in the leg,
Okay.
or severe abdominal pain that's unrelenting. Again, this is associated mostly with the J&J vaccine,
Okay.
or the AstraZeneca, which is not available in the United States.
Okay.
So,
And again, it's not available to anyone yet.
the AstraZeneca in the United States now,
Yes.
and the J&J is not available to people younger than adults,
Yeah.
right? And how awkward to talk about children, people younger than adults, but I think everybody
fine.
figures out what we mean, right?
You're fine.
But that's very specific to that.
Yeah.
And here we're talking about the Pfizer. That's
Yeah.
the one vaccine currently
Yep.
that is available to children between the ages of 12 and 16.
Yeah. Okay. So, something else, there's been, a rumor that or worry, a concern that vaccines could possibly impact fertility. What have you heard about that?
Well, what I've read and heard is that those are unfounded
Okay.
claims that while fertility was not specifically studied, they state that very clearly, that they have not actually seen any loss of fertility reported among any trial participants or among the millions who've actually received the vaccines. And no signs of infertility appeared in animal studies, so going further back, right? And that there's no evidence at all that COVID-19 vaccine affects puberty.
Okay.
So, and we're going to, I guess, touch upon this later, but what I would urge is when you hear stuff like that, I guess 2021, you go to Google, right?
Yeah.
But even there, you can narrow your search to some trusted and respected sources.
Yes.
Like, for instance, in this case, the American Academy of Pediatrics. They have a lot of freely available information that's very clear, easy to understand and follow as well.
Okay. Excellent. So if I want to get my child vaccinated, but they are younger than 12, how do I keep them safe?
Yeah, and every day they're doing more in terms of research and studying and going further younger to see the safety and efficacy and to be able to open up those next portals, if you will, of age categories. In the meantime, as long as your child's over 2, right, because they don't recommend masking for children under 2.
Yes.
Then we continue our masking, social distancing, hand hygiene, to keep them safe.
Okay. And how do I talk to my child about vaccination?
So, and it depends what age category,
Yeah.
I guess, we're talking about. And, for younger children who at this point don't have the option of that vaccine available. And when that becomes available, because we anticipate it will, there will be further guidelines on how to approach this, but certainly trying to approach it from their level of understanding and comprehension in terms of explaining that this is to keep them safe from getting very sick and helping other people as well. Right. For the teen category, they probably have a decent comprehension of what's going on. Certainly, they're probably keeping up with what's going on around them, and very clearly, it's impacted their social, settings and interactions. And again, fact-based to their level of comprehension and understanding, discussing the benefits to the safety, the safety of the vaccine to date, and then subsequently the safety factor in keeping you protected and safe from getting seriously ill or having serious burden of disease, hospitalization, and or death. And again, in many ways, looking at it as another step as we journey out of this pandemic and this public health emergency, and broadening what we're able to do safely in groups.
So I know that you're a mom.
Yeah.
And I know your daughter's a little bit older than the target group that we're talking about, but would you mind sharing your experiences in discussing the vaccine or handling the vaccine with her?
Sure. So she had the option where she was of having the AstraZeneca vaccine, which has a very similar profile. It's a viral vector like the J&J.
Okay.
And clots were found.
Okay.
In that with that vaccine as well. So we had a lot of talking to do,
Mm-hmm.
and concern, and looking through the risk benefit profile, and she's older, so we had a collaborative discussion, not
Yeah.
top down
Yeah.
kind
No,
of discussion.
this is what you're doing today.
Yes, and we looked at it, and we both acknowledged, and her father was involved in the conversation as well.
Mm.
Family dynamics, right? But we talked about the risk to benefit ratio and the fact that while it still remained an exceedingly rare risk, even with that, though it was a risk, it was an exceedingly rare risk, and there was a greater risk if you got COVID
Yeah.
of having that same kind of side effect of the clots.
Yes.
And once we realized that, and we realized the benefit to having the protection and being vaccinated, we all became more accepting
Mm-hmm.
and positive. And she has had her second shot
Excellent.
with no complications.
Yeah, that was my next question.
Yeah, I
How's she
think
doing? Yeah.
I probably gave her more of a headache than any side effect from the vaccine, from my constant checking in. But you can't help that as a
No,
mom,
no.
right? So I think she's forgiven me that too.
I think she might have been sad if you hadn't done that. So, if a child has already had COVID, should they still be vaccinated, or are they already immune?
Yeah, and we get that question for adults as well.
Absolutely,
Right?
yeah.
And the answer today is yes, you should be vaccinated,
Mm-hmm.
regardless of whether or not you've already had COVID-19. At this point, we still don't know how long you're protected from getting sick again after having had the viral illness that is COVID-19, right?
Sure. Yep.
So, given that, and knowing that the vaccination does give you the additional protection of that against really serious illness, debilitating disease,
Yeah.
and death, the recommendation is to have a vaccine regardless of your previous COVID status.
Okay.
There are at this point, from my understanding, if you've had actual convalescent plasma or monoclonal antibody treatment, then you do want to talk to your doctor about timing,
Okay.
because those folks still are asked at this point to hold off before they get it, but they're still advised to get it,
Okay.
right? But for the children, absolutely, the recommendation is still to go ahead and get a vaccine.
Okay. If your child is vaccinated, why do they still need to wear a mask at school or for indoor sports?
Right.
Because now it's not required
For
outdoors.
Yeah. And again, same question that we as adults,
Yes.
have to face, I guess, every day.
Every day, yeah.
And I guess on the good side of that is looking forward.
Yeah.
There are graduated decreasing mask requirements moving forward in time. I think in a week or less than.
Yes.
There are some big things happening right in Massachusetts.
Yes. Our next podcast, we may be without masks.
That's right. That's right. Still in the healthcare setting.
Yes.
So at this point, just as a reminder.
Yes.
The main reason is you can't be clear on who's vaccinated and who's not.
Yeah.
That's probably the biggest reason right now that we are still asked to comply with mask wearing and social distancing in spite of our own personal vaccination status. And even in the guidelines that you've seen put out for the allowances that they've given us, post-vaccination, like, if you're with other vaccinated people, then you don't need to necessarily wear a mask.
Yeah.
In a private setting. I think, again, as we look at that, you see greater liberties coming along. I almost hate to use the word liberties because I don't want to
It's okay.
add to it, but you see that there are less mask usage
Sure.
requirements as we move forward, and with the vaccination. But again, it comes to not really knowing the vaccination
Yeah.
status of individuals, and it becomes sometimes a rather prickly, thorny question.
Yeah.
So I think for the safety of everyone, that's one of the reasons that they want to go ahead and do that.
Got it. So if my child is vaccinated, is it safe to have playdates with non-vaccinated kids? And if so, how should I navigate that?
Yeah.
Sounds like mask wearing would be a good start.
It does. It does. I would advocate
Yeah.
for mask wearing in that circumstance, and that may be something that you want to discuss again with your pediatrician.
Yeah.
To be, certain that, as you bring these things up,
Yeah.
again, it gets the dynamics
Yes.
of interactions get very tricky. But I know that we all want our children to have interactions with other children. Like that's a huge thing during this pandemic that we have kind of looked at and said, wow, we do need social interaction. We do need other human beings.
Yeah.
And so certainly starting off with mask wearing, social distancing, and hand hygiene and washing of hands is a good place to start in that circumstance. If you want to try to have an interaction with someone who isn't. But again, speaking with your pediatrician to get further guidance would
Okay.
always help. And, depending on what your relationship is, with that family, also discussing maybe even vaccination.
Sure.
Why it's a good thing,
Yeah.
right?
Okay. How long do the vaccines last? And will I or my child need to get a booster shot?
That is, I would love to have the answer to that question, but we don't have that yet. That's still
Okay.
something that's being studied and evaluated to determine the length of protection afforded by the vaccine, and whether or not there will need to be any kind of booster shot in the future. That is information that is yet to come to us.
Okay.
But as soon as maybe we'll have another podcast then.
Yeah.
Right?
Absolutely. And what do you tell people who believe that the threat of COVID-19 is over, at least in this country, because we're still hearing some
Sure.
devastating news out of India and other countries, of
Yes.
course.
I'd say that's a little premature.
Yeah.
I'd say keep up the hope because it's coming.
Yeah.
And some of the signs that we are so very close include, we were talking earlier on May 11th, Banner Day, there were 0 deaths recorded in the state of Massachusetts. And that I'm still like giddy over that.
Yeah.
COVID-related deaths
Yes, of
in the
course.
state of Massachusetts.
Yeah.
And speak to everything else. So, there are signs that the numbers of cases are dropping profoundly, and it is a steep decline. It's a steep curve on this back end, which is super exciting, right? We haven't quite gotten there with the vaccinations yet, but we will.
Yes.
As we mentioned earlier, things are changing. May 29th, right,
Yes.
is a big day for the state of Massachusetts again. And, it's happening all over the country based on what the numbers reflect. And if we can just hold out until we really, truly get to the other side of this, then it will be a nice, safe place to be.
Yes.
And I, for one, can't wait. I don't know anyone who can really,
No.
right?
I think we're all ready.
Yeah, this has been, it's not over yet, as we
Yeah.
mentioned, but this has been quite the journey.
Yes, I agree. So if someone, we did touch on this earlier, if someone hears something, reads something on social media
Sure.
that raises a question in their mind about the vaccine, where should they go for accurate, unbiased information? I know we already discussed.
Yeah, no, and we can't discuss it enough.
Yeah.
And I'll tell you, I go deep in the comments. I'm ridiculous. Don't do it. Save yourselves. But I go in because I want to understand, what people are thinking, what people are saying, I'm shy about posting, but I almost want to put up the AAP, AAP, American Academy of Pediatrics, as I mentioned. Their site is fantastic. It's easy to navigate.
Yeah.
It's very clear language. And they are very clear about their recommendations,
Yes.
right? And they have a position statement. And we didn't mention it, but there's even note that you don't have to wait the 14 days for your children between vaccines.
Oh,
Right,
I'm so glad you brought
so-
that up.
If you get the COVID vaccine.
Yeah.
And with their we're beyond that, timed vaccine in our family, but
Yeah.
when you have to get your regular shots. The CDC is still our most reliable source.
Yeah.
It's our Center for Disease Control.
Absolutely. Yeah.
So the CDC, the American Academy of Pediatrics, I will say that most of your, quite honestly, doctors' offices or the bigger systems, if you're a patient with a portal, usually they have a banner that says COVID-19. They've got reliable information. It's your healthcare source.
Yeah.
Right. So they've got reliable information, and contacting and speaking to your PCP or your child's pediatrician is invaluable.
Yeah.
Partnering together on moving beyond this pandemic is what's going to get us there.
Yeah. Well, I can't thank you enough for all of your time.
It's my pleasure.
Yeah, thank you for leading us in this continuing journey.